Brown, neurosurgeon, who we will be talking about. Is an assistant professor of neurosurgery at Mayo, Florida, and we'll talk about the role of neurosurgeon in cerebral edema and cerebellar hematomas.
So I'm going to talk about just the one or two brief slides there that Dr. Vedic showed that comes at the end of all of that medical care when things are sort of in dire straits and surgical intervention needs to take place. I have nothing to disclose. I'm going to talk about a little bit about the history and general principles of craniectomy, basically, is what this will focus on. I'm going to talk about its use in trauma, talk about the surgical technique, talk about it in stroke, ischemic stroke, and then a little bit about counseling our patients. So this type of surgery goes back to many thousands of years into BC time period. These are some skulls from Peru in the Incan civilization showing trephination performed way back at that time, thought to maybe be releasing evil spirits. Here's a skull that has a piece of nut that was placed into the skull with bone that has grown over it, suggesting this was done before the patient passed away. So this is, a cranioplasty here, basically putting the bone back. So this has been done for thousands of years, and unlike what a lot of you all do with critical care and anesthesia that has evolved a lot, this is basically what we're doing now. So, I'll go into that. But basically, in the modern era, this starts with Monroe and Kelly and Abercrombie, who started to look at the skull as a fixed box and the contents within it and what was going in and out. Magendie made a contribution to understand that CSF is one of those important characteristics. And Burroughs started to see that these things do change. The CSF comes in, the CSF comes out, the blood vessels constrict, they dilate, and these volumes can change. And then Harvey Cushing, considered the father of neurosurgery, kind of synthesized that into an equation. The volume of brain plus the CSF and the blood is equal to the total volume of what's in the skull. And maybe as a surgeon, if we can alter that volume, we can maybe make a positive impact. The first modern description of decompressive hemicraniectomy was in the 1900s by Dr. Coker. But I turned to Wikipedia. What is a decompressive craniectomy? Basically, a neurosurgical procedure in which part of the skull is removed to allow a swelling brain room to expand without being squeezed. So not too difficult. Why would